Jerusha.
Waigirira ku.
Ngoke yako ikia huko nani kwa my sister.
Mukanuta njira rendo ume uthinde na wira muingi muno ni.
Geke uragurire ku.
We ni guthaka ratha.
Iticio harutire ku cia migio na njeki.
Atiriri gite giki ni ndike importete kuma murimo we.
Ndini no ngutwe handu ngava na guraga iti. Haiya, tari tuthie one. Tuthie. Ogetekia kiugo giakwa.
Ndathi ndona ni urimo ni ugweteki.
Ti urimo. Tari tuthie one ite icio.
Tuthie.
Ni tuthie. One ite kwagira.
Tuthie. Ndugitike kuguca ndukanude.
Rora kamera.
Atiriri ginya kamera gathaka gatha.
Urauga atia? Rora giti.
Giti cio gwetha ici nie.
Dikraina. Giti kiega. Giki nikio gitagwo kangaroo. Giti kiega.
Ni uko ni kwa makia. Ndiragura ciothe ici. Ici ciothe.
Na reke nguthiture. Ni transport yo heagwo bure guku.
Du.
Transport ni bure.
Na gite kunjira ni kindetu weyo.
Ti nyamo icio hathire kugira cia migio na nyeki.
Ikamenya ni kiriko na kiriko ndirathura.
Ndugetikire gicono gutagiki. Generation Furniture Mart ni njuru cia wendi wa furniture star, kabati, metha, dining table, itanda, gatakati kaingi ni gukugatira uge muta uyu gwaku. Tuce nduka-ini itu muno wa scooter, account ya Nyeri kana uhure thimu namba 0721 174 477 na ni tuka delivery. Generation Furniture Mart, where quality meets comfort.
Thank you so much for joining us. This is the Medi-Camp Health Show. I am your host, Mumbi Mavuti. As promised in the previous episode, you're going to be delving deeper into some of the mental health issues that we highlighted in the other episode. Joining us still is psychiatric nurse Christine Wanjiko, who is going to be taking us through this. Thank you so much and karibu for this episode. Yeah, just take a moment and greet our viewers and welcome them to the show.
Thank you. To our viewers, it's another moment that we are here to discuss about mental health. It is an issue in our country, not only in our country, Kenya, but globally. But we're going to go into details about the bipolar mood disorder that we have, the type 1 and type 2, and the schizophrenia. Thank you. Stay tuned and listen.
Yeah, stay tuned. Let's learn more together. So these issues are here with us, but a lot of people, I believe, are not even aware about some of these disorders. So what exactly is bipolar disorder?
So bipolar mood disorder, it's a disorder whereby characterized by the extreme mood. Mm-hmm. One time you are very happy, extremely happy, and other times that you are in a very low mood, that is depression. Mm-hmm. So when you are in an extremely high moods, mm-hmm. we call it maniac. Mm-hmm. And for the maniac, as I mentioned last time, mm-hmm. you can be able to pick it because it lasts for 7 days, mm-hmm. but for the depression, lasts for more than 2 weeks. Mm-hmm. Yes. Mm-hmm. So bipolar, we have the types. We have the bipolar mood disorder 1 mm-hmm. and bipolar mood disorder 2. Mm-hmm. Yes.
And those are the types of the disorders.
Yes.
They're the only 2 types of bipolar disorder.
Yes.
So when you talk about mood swings and mood changes, what exactly do you mean?
For the mood swing, mm-hmm. you might get an individual who is, mm-hmm. let's talk about bipolar 1. Mm-hmm. And I want to describe it, mm-hmm. and maybe you have ever seen someone mm-hmm. in that state. Mm-hmm. Bipolar mood 1, mm-hmm. this person is distracted, mm-hmm. they cannot concentrate, mm-hmm. they are euphoric, they are grandiose, they will tell you things that are out of these. So their self-esteem is very, how do you call it? exalted self-esteem. So they will be telling you maybe they are related with the president, they are the son of the president, they are grandiose, very high. And their speech, they have a lot of things they do, like talking a lot and the pressure of the speech. So they can talk and talk and talk without stopping. And the fright of ideas. So if you start the conversation with them, you will not continue with the same conversation. Maybe you are talking about the school, and they will shift mouth from the school, maybe from the work they are doing, maybe there's something else they are doing. So they keep on changing from one topic to another. So we call it the fight of ideas. So they are not consistent with the one topic. They normally have a decreased need of sleep. So most of the time you'll find them like in 24/7. Either they are on the move and they are talking. So rarely do they even sleep. They have the appetite, yes, but rarely do they finish the meal. Because wanaona kukaa chini kukula food, it's like wasting time. So they are always on the move. These are the people who will start doing something and they will not finish. So they can start a task, 1, 2, 3, 4, and they will not complete. So by the end of the day, if you check what they have been doing, you cannot even tell what they were doing. So for these people in the maniac state, we'll have mnemonic word for them and a dig fast. So when we say dig fast, we start with the D, distractible. They are not still. I, insomnia, so they don't sleep. G, the grandiose. We have said they have elated self-esteem. A, activity is increased. S, we have said about the speech. They can talk and talk and talk. And then the T, thoughtlessness. So the things they are telling you, they are not making sense. So if you find somebody whom you're having a conversation and you pick either those signs, you'll know that person is in the maniac phase. For the depressive, they will have now the opposite of the other. Either they will eat, they will have low mood, they will have the suicidality part of it. So it alternates. And let me say with the bipolar, and I will give an example. You might be having a conversation with someone, and a normal conversation, and all of a sudden the mood changes, a labile mood. They were laughing at this moment, and the next moment they are crying. That is the bipolar. And those are the people that we are having in the mainstream of the society. Hujamfanyia kitu, but analia. Unashanga, what has happened? So you can pick, because they are there in our society, but let me clarify this. We are not supposed to do the self-diagnosis to people because we are living with them and say that they have the bipolar. Yes.
And let's talk about the mental stability for these people, especially the ones with bipolar 1. Are they going to be kind of violent or aggressive, excessively aggressive when you're dealing with them? Because you said they're always on the move. They are active like all the time. So when you're trying to engage them, maybe you're trying to distract them, could they get violent?
Yes, they can. When you're approaching these people, and especially in the maniac phase, you're supposed to remain calm. Because the moment you raise your voice, it's like a trigger to them. So they will attack you. So you remain calm, but be firm. When you remain calm and firm, you will give the limits, you set the limits of the things that you want to tell them in a very calm way, and you set the standard. If there is something that they are doing and you don't like it, and maybe it's something that is going to cause harm to them or to someone else, let them know whatever they are doing is not right, and they need to stop, but in a very calm way. Yes.
That is nice. And what is the onset, or when do these conditions seem to appear? Can you be born with it, or do you get infected with it later on in life?
Bipolar can be picked even at an early stage, but initially when it occurs to the children, we need to differentiate this, because there are so many things that comes with the children, because we talked about the ADHD, we talked about autism, and still at the childhood there is the conduct disorder. So for this mood swing, you can pick it. There are kids that will be very happy at a moment, and the other time they are crying, or they are in a very depressive mode. So we said about the bipolar one, it's when the moods, they are elevated. That is the maniac. And the two has now the part of the depression. But we have the mainstream of people who are hypomania. And these are the people that we are living with. Maybe you have ever heard about people who will tell you, I can call the president and the president will pick my call. And when they laugh, ni ile kicheko kubwa sana. They are the people who have the grandiose of how important they are in the society, the people they associate with, and they will give you stories of the things ziko juu tu sana. It can happen to the children. And that's why I'm saying there is no specific age. You can be able even to pick bipolar even with the children. Because these are the kids when you wataanza na hiyo tu. But you know, I'm the son of the president, I'm the son of the deputy, I'm the son of the deputy governor, I'm the evil. They will tell you. They will associate themselves with very high people in the society. And when it continues, those are the people now, even at their adulthood, they are still having the bipolar. Let me say this, Mombi. Most of the time we tend to miss making the diagnosis of this. Because these are the people, these are our relatives, our brothers, our sisters, and the people maybe that we are working with. And we find it it's normal. But in the real sense, these are the people who are suffering from bipolar. Yes.
And when we're dealing with these conditions, what are some of the triggers? Because there are some factors, we couldn't say like there is an exact cause, but there are going to be certain things, maybe environmental factors, the genetics. What are some of the triggers for these conditions?
Some of the triggers for the bipolar, let's say the stressful event, they trigger and they make them, either they have the mood swing, go to the maniac phase, or on the lower side, that is the hypomania, or the depression part of it. If you are grieving and you have lost a loved one, a normal person will negotiate very well and comfortably, maybe for 3 months, because that is the normal grieving. But for someone who is suffering from the bipolar, it might last longer. If you have lost a job, you might be able to tell, maybe this was my mistake and I saw it coming. But for bipolar person will not understand why they have lost the job. So maybe they will go, they confront maybe their immediate supervisors, and they'll have issues even with the people they are working with. So there are the events that normally happens, the normal events that can happen to you, but to them, it is a trigger. How we cope with the emotions, to them it's a bit different. And for bipolar, it can be managed very well. And especially if the person realizes they are having the symptoms. We have friends, we have people who have bipolar, and they can tell you my emotions, and I feel that I'm not okay and I need help. Because already they have been trained and they know what to do, what to look for, and especially when you're having a relapse of the maniac phase. So the stressful events, and let me say, not only the stressful, even the happiest moment. When you are celebrating and everyone is celebrating, to them, it might change. Na ikuwe kitu ingine. Instead of controlling the happiness, they go to on the other side. Yes.
And you're mentioning that these are the people we are dealing with day to day.
Yes.
And we think it is very normal.
Yes.
So how do we handle them? Well, if you spot one maybe at your work environment or at home or in your friend group, you spot that this one could be bipolar, how do we coexist with them?
I've said living with them is very easy. You can realize your friend doesn't like being cherished. You can realize your friends, the mood are not stable. So when you realize these people, they don't like, it's like confronted. You'll know how to coexist with them. Because the moment you trigger their emotions, you'll end up having now the other side of them. For instance, if these people, they are sad, and maybe you tell them that something that, maybe you can pinpoint something that they don't like. We talked about the labile mode. Badala ya confront ama akurudishie, they will end up crying extremely, uncontrollably. So if only we can be able to understand the people that we are working with, not only the conditions that they are having, because we cannot say that the people that we are working with, they have the bipolar, but maybe they have the personality disorder. Yes. So let's not be conclusive that they are having the bipolar until they are being diagnosed by a specialist. Yes. And we also don't forget about the personality disorders, because the personality disorders, we say there are many, and they can still behave like they have the bipolar. Yes.
Before we carry on, you mentioned that we should not be diagnosing our friends or these people and saying that one is bipolar. So what does diagnosis involve? How do you know that this one is bipolar? Like when they come to the hospital, what do the tests involve? Are they only psychological, or is there a physical test for it?
Let me say, for us to be able to diagnose any mental health disorder, there is the criteria that is being used. And one of the criteria that is being used, we call it DSM-5, a diagnostic manual statistic that is used globally. And this one will give you the criteria, depending on the presentation of the patient or the person that you are seeing, you can use that criteria. Just to pick the, for instance, for the bipolar, if I want to diagnose the bipolar, I have to check the modes. And then I have to check the signs and the way the person is presenting. So with the criteria of diagnostic DSM-5, I can be able to tell whether the person is having the bipolar 1 or the bipolar 2. That is one. The other one, you can do the clinical interview with the person that you are seeing. For the clinical interview, that is the individual direct to the patient. There is the presentation they will come with, and you will be able to pick. Not only asking the questions, but you can be able even to observe. How are they behaving? How are they responding to the questions? Do they have mannerisms? How is their mood? How is their thought? How are they processing the information that you are giving? So that is the clinical interview that you will do. The third one you can do when you are doing the diagnosis, you'll have the collateral information. And the collateral information, you don't collect it from the patient, but the people they are living with. So maybe the relatives will come and tell you, this person or this our relative, he has not slept for the whole week, he doesn't eat, he talks things that are not making sense, he's very distractible, he doesn't complete the task. So you can be able even to tell this person is the maniac phase. And when they talk about even the days and the duration of the things, maybe they have observed, because most of the time relatives will come and tell you, for the last 1 month, this person has not been still. This person has been very aggressive. And you'll wonder, why would you keep somebody who is aggressive and who is fighting at home for the whole month with you with no seeking treatment? So they will tell you. They will tell you all the things the patient has done. And then you can do now the medical investigations to rule out other conditions. Because we said, not only that we take the mental health, you cannot conclude because the person is talking a lot and maybe they are confused or they are behaving in a certain way, they are having a mental disorder. What if they have other medical conditions that are making them be the way they are? And I will say the medical conditions, some of them maybe they are diabetic, maybe the sugars are high, and they are getting confused. They have hypoxia in the brain, and that's why they are confused. Maybe the urea, koju, there are those things that we check, and you realize whenever you do the baseline investigations, some of the tests that you do, even for the kidney, you want maybe to check whether the kidney of the patient is functioning well. They are high, and when they are high, they distort even your mind, because the brain is already altered. So you might conclude the person is having a mental disorder, and maybe they are suffering from a medical condition. So we have about 5. There is the observation, there is the collateral information, there is the clinical, there is the DSM-5, and then there is the personality checking. When you check the personality testing, you check from other people, because you cannot tell us who you are, Mumbi. We need to ask someone else with a questionnaire. Please fill this questionnaire for us so that we can be able to understand who is Mumbi. So the clinical diagnosis, it's wide, and we don't stick with one. That's why we said don't do self-diagnosis, because we need to check all the parameters and we need to check all the criteria just to know what you're suffering from. Yes.
And that there are known root causes of bipolar disorders?
Not really that you can pick one. As we said about other conditions, they are genetically predisposed. If there is one person in the family who ever suffered from the bipolar, he's called Winston Churchill. He was a British politician. He suffered from bipolar. So bipolar, it has been there. It is old as a humankind, but most of the time we tend to miss it. Yes. So it's not something that is new. It's something that has been there. The father of medicine, Hippocrates, at one time he said that people are suffering because they have a foul smell in the mind, and he decided to drill the mind to release whatever was there. So bipolar has been with us. Yes.
And is it a lifelong condition, or once you are diagnosed with it, can you get well? Can you get totally cured of bipolar?
You can manage with treatment. Yes.
But there isn't a known total treatment for it.
Cure, yes.
But you will manage
it. Yes, you can manage it.
And is it preventable?
As we said, all the conditions, they are preventable, because we said about the primary prevention part of it. This time when we talk about the prevention of bipolar, we are not going to take bipolar as the only condition in the mental disorder, but all the other mental health disorders that we have. And we talked about the primary prevention, whereby we said if there is something, like if it is the mothers who are smoking, drinking, if they can stop,